Be aware of the Medicare Medi-Cal Covered California trap. Hello, I am Kevin Knaus with InsureMeKevin.com, an independent health insurance agent in California, and also a Covered California certified health insurance agent. And I've had several couples where one of the individuals transitioned to Medicare, and all of a sudden, the spouse who was in Covered California with the subsidies gets flipped into Medi-Cal. And everyone's wondering, how is this happening? Well, it kind of starts with good intentions on the part of Medi-Cal because they administer what is called the Medicare Savings Program. So when they are alerted that someone is now Medicare eligible, they have original Medicare Parts A and B, and maybe that's because they've turned 65 or they have left employment after 65 and are now fully eligible for Parts A and B, they'll send out a letter, say, hey, maybe you're eligible for the Medicare Savings Program. And the Medicare Savings Program is terrific. If you qualify with a monthly income that's low enough, Medi-Cal will cover the Part B premium and potentially the cost sharing of original Medicare Parts A and B. It's excellent, especially for people who have very low incomes. But for people in Covered California, many times they don't qualify, and usually the remaining spouse does not want to be flipped into Medi-Cal. So we need to look at the Medicare Savings Program income limits to understand how this happens. So the very highest level of extra help under the Medicare Savings Program is called a qualified Medicare beneficiary, and a married couple can have no more than $1,724 in monthly income. Right underneath that is the specified low-income Medicare beneficiary, where a married couple can have no more than $2,064 in income. So if Medi-Cal determines that the household income is under those ranges, then the person who is in Covered California must necessarily go into Medi-Cal, because for a couple in 2024, if a two-person household, if the monthly income is less than $2,352, then all adults go into Medi-Cal or Medicare and Medi-Cal. Now, for this particular couple, Lydia and Stephen, they had an estimated Covered California income of $61,800. Now, this isn't necessarily traditional income from Social Security or wages. They have rental income, dividends, and interest. It wasn't necessarily monthly income that they're receiving. It's coming from various sources. And when Stephen got the letter about maybe qualifying for this Medicare Savings Program, he sent in his information, and Medi-Cal looked at it and said, oh, you have virtually zero income, you qualify. They go into the Covered California account, change the income, and now Lydia is Medi-Cal eligible because the county eligibility worker wiped out the household income for Lydia and Stephen with what Stephen had provided to the county. And then all of a sudden, Lydia gets a letter from Covered California saying that a reported change requires your case to be reviewed by Medi-Cal. What's going on? And at the bottom, your household income is too low based on the household income of zero for the month, because Medi-Cal and the Medicare Savings Program looks at your monthly income, not the annual income. And you can get into your Covered California account and look at the case history. And in this particular case, you can see how Orange County had gone in and made a bunch of changes and reduced the income to zero for the household, flipping Lydia into Medi-Cal. Now, Lydia nor Stephen ask Medi-Cal to go into the covered California account. They just do it. That's just kind of the way they are. It seems like Medi-Cal doesn't really understand how covered California works, and sometimes they're also getting information that isn't correct, because for covered California, it's the household income on an annual basis, not the monthly income. So all this happens, and it just generates a lot of wasted time, because Lydia needs to contact the county and say, oh, no, this is a real income and you need to go back and fix this. I don't want to be flipped into Medi-Cal, even though Stephen applied and it looks like he's eligible for the Medicare Savings Program. So all that takes time to be fixed. And then some of the other odd things that we see when Medi-Cal gets into a covered California account, and no one asks them to go in there, no one invites them, no one gives them permission, they just go in and do it. On one particular account, I've seen this on numerous occasions, household members from years earlier are then added into the account. So on one family, Tanya and Tomas's children that are adults, that have their own employer-sponsored health insurance and have been out of the house for years, were added into the household. And this, 28 and 29 years old. I mean, they're on their own. Why are they back in the household? And this creates another problem, because the larger the household size, even if some of those household members are not participating in the Covered California health plans, and it looks like the parents are taking them as dependents, that increases the subsidies, because the subsidies are based on the household size. Larger the household, larger the subsidies. And when the couple goes to do their taxes, they're going to have to repay subsidies, because they're really only a household of two, not a household of four. Another thing that we have seen, that I have seen, is that when Medi-Cal gets into an account and there's still some Medi-Cal eligibility that needs to be cleared up and wiped off, the subsidies are frozen. So oftentimes I will see a couple in, say, 2025 with an abnormally low subsidy, and when I look at it, it's the exact same subsidy from 2024. Now, in these particular cases, the household under what Medi-Cal looks at is not eligible for a subsidy, but the Covered California system just takes a 2024 subsidy and rolled it over into 2025. And so it is too low, and the people that are enrolled in health plans are not getting the full subsidy, so they're paying too much for their health insurance. Sometimes if Medi-Cal fixes the eligibility determinations, we can go in and just report a change, and that brings back the proper subsidies. I've seen that on numerous occasions, and then you can move forward. But if it is not fixed, when the household does their taxes, they will get more subsidy on their IRS federal tax return. However, that isn't helping the people during those months when they have a low subsidy and they're paying higher health insurance premiums. So Medi-Cal just seems to create all kinds of problems in these Covered California accounts. So if you do get a letter because someone is transitioning to Medicare, carefully review if you want to send Medi-Cal, your county, any information about potentially applying for the Medicare Savings Program, because they may not understand your income. And if they determine someone is eligible, more than likely the remaining household members in Covered California with a subsidy will be flipped into Medi-Cal, because in order to qualify for the Medicare Savings Program administered by Medi-Cal, the household income must be below the income thresholds for the Covered California subsidies. That's a lot to digest. If you have any questions or comments, you may leave those down below, and I will do my best to answer them. Otherwise, for InsureMeKevin.com, I'm Kevin Knaus.